What do you think doctors would do without help? Having to do everything by themselves, running the office as a one-man show. Medical assistants are there to take some of that slack off of the doctors. A medical assistant runs the front and the back. Two different people, but they do everything. The medical assistant in the back is taking vitals, updating charts, drawing blood if the doctor tells them to or if it's needed, giving injections if they're told. They keep up the rooms, keep them clean, nice and tidy, changing the papers, making sure everything is sanitized and disinfected, making it clean for each patient after each patient, before patient has left. They have everything ready for the doctor so that they can have a smooth visit with each patient. They take the time to do this so that the doctors can talk about what is important and not waste the time on the remedial things. The medical assistant will usually spend anywhere from about 5 to 20 minutes with each patient to update and prepare the patient. This is the time not wasted by the doctor. Don't get me wrong, there's no such thing as wasted time, but preparing the patient is not a waste of time at all for a medical assistant. This can help the doctor get a lot done in that time, especially because a lot of doctors do rounds at hospitals or preside over other buildings with different patients. So they're constantly between buildings, on the phone, dealing with patients, getting phone calls. They're dealing with a lot of things. The thing is, most medical assistants do more than just checking in the patients. They also keep things moving smoothly within the office. The provider does not have to stop to give injections or draw blood for labs. They have more pressing matters to attend to. We also keep up with patients, medications, and referrals by handling their authorizations. It can be a grueling process, and many require a couple attempts. By handling these things, we saved the time that the doctors need to deal with their patients one-on-one. We save a lot of irritation for the patients by dealing with the insurance companies and files between different offices. This can be time consuming because a lot of times they don't have the right information ready and they don't know all the information that you need that is regarding to your request. With keeping up with medication refills, we keep the patient on their regular schedule. For some people, this can be the difference between life and death because a lot of people need their medications to survive. Without a medical assistant, the doctor would be on their own, handling a busy office on their own, having to deal with all the before-mentioned stuff along with seeing patients and doing hospital rounds or whatever else they have gotten themselves into. They truly do take on the world, and not enough people appreciate that. This could quickly become overwhelming for anyone, especially somebody who has so much on their plate already. You never know what's going on, so you try to help as much as you can. There is only so much one person can do, and everyone needs help whether they choose to admit it or not. Doctors will always need an extra hand, whether it be a medical assistant or someone with a different title, but with all the different jobs needing to be done around the office, this is how a medical assistant was born. There will always be a need for us. There will always be a need for somebody to help the doctor with their daily tasks. Today, I discussed with you why every office needs an assistant. Doctors would not be able to do their jobs as effectively without someone to help them in. It is never a bad idea to ask for help when you need it. That's what we're here for. The more we help, the smoother things go. You'd never want somebody to have to take on the stress of dealing with an office by themselves. If you left it to themselves, things wouldn't get done. Patients' charts would be messed up. Not every patient would get seen on a timely manner. Patients would be backed up. Their appointments would never get scheduled. They'd be scheduled for months out. There's never not going to be a need for a medical assistant in the office. There's too much to do and too little time to do it. If the doctors had to do this by themselves, they would never get it done. So the moral of the story, don't be afraid to ask for help because everybody needs a little help every once in a while. You never know what they're going through and they're always going to need some help no matter what. So please help them. That's what your job title is.